We are going to look at what we call evidence-based practice. This is a session that you can term as this is a prerequisite course for research. You see, some of you may actually understand research methods and methodology, but you might have difficulty translating those principles or concepts that you have learned in research into real practice. Okay, so this prerequisite course actually prepares you for that, and I think it is as important as the research methods course unit. Okay. So what are we supposed to be looking at in this course? You are supposed to understand what evidence is, where do we get evidence, how can we evaluate evidence, and how can we translate evidence from research into practice. So those things that I've just mentioned, they look like very simple things, but they actually require some attention. You need to pay attention to these concepts quite well, such that it becomes very easy for you to integrate this into your practice. Okay, so it is very, very, very important that you understand these things. So I had predicted that we can cover the major concepts in 1 week. We'll see how that works out, and if we are not in position to cover this content in 1 week, then even the coming week we should be able to continue and until we are satisfied that we have actually covered the key things that you ought to basically know. So in the session for today, the first session that we are having, we are basically introducing ourselves to the terminologies related to evidence-based practice, and then thereafter we shall look at the benefits, we shall look at the barriers, we shall look at the challenges, and things like that. So our first session basically starts now. So I've prepared these slides with the thinking that all of you from your different fields, you need to make decisions based on evidence. So I will always refer to you as health workers or health professionals, or basically professionals. The most difficult thing that professionals actually confuse in line to do with evidence-based practice is the confusion between quality improvement, evidence-based practice, and then research. Okay, what's the difference between those three terms? Definitely in our work we have those, we carry out these things. We carry out quality improvement interventions. Also in our care for patients, we make sure that the care is actually evidence-based. And then we also carry out research. So what are the things? So we need to understand what they are, because overall they are important in improving the quality of care that we provide to patients, because if we have good quality of care, then it means that patient outcomes or health outcomes will actually improve. But of course, we need to understand the distinction. So we start with the quality improvement. What is it? Often, if you hear people talking about QI, in most times they are referring to quality improvement. So quality improvement is a local process that is aimed at improving systems, processes, and outcomes within a unit, department, or an organization. So usually we have what you call quality assurance manager or quality assurance officer, or basically the head of department or the nurse in charge, whatever terms that you have. These people, one of the things that they actually do is to make sure that the operations within their unit, these operations are moving smoothly. When we talk about operations, we are thinking about the systems that we are using. For example, the laboratory, the pharmacy, the emergency ward, or the emergency department. You will have a number of things within these different departments. Whether you're talking about a patient entering the emergency unit, what is done to this patient? These are the processes. What systems will this patient interact with? Okay, so if we say that there is a delay or because of malfunction of a particular system, or because a particular process is taking too long, or the patients don't actually get better, then within that department we can have the managers interrogating, because they have identified a problem. They need to understand this problem and then devise means to improve the process. That is usually quality assurance. Okay, quality improvement. Sometimes we usually talk about quality assurance, but that is basically quality improvement. Okay, so to make sure that things are moving smoothly, improve the existing processes, and therefore, in that description, you don't see generation of new knowledge. Generation of new knowledge usually comes from research. Okay, so quality improvement does not involve creation or generation of new knowledge. So after instituting changes within the department, then you have to monitor and see if these changes are actually improving the processes. Okay, and then you make sure that the people actually adhere to these new systems that you have put in place, and that is what we term as quality improvement. Now, when we move to the key features, remember the quality improvement is about making sure that there are no delays. We have efficiency. Okay, we have efficiency, and there is better performance. You get the best out of the resources that you have, whether it is human resources, whether it is whatever resource that you can have in a unit. You want to make sure that they are working efficiently. And if they're working efficiently, that is optimal performance. And when you have optimal performance, then you have better patient outcomes or better patient satisfaction. The patients are satisfied with the what? With the services. Okay? So, sometimes you can have a practical problem that can be improved through different measures or interventions. Or you can have a problem that has been identified, and that problem takes us to what we call evidence-based practice. And then we look for the best evidence possible for us to be able to tackle a particular problem. So you can have quality assurance issue translating into what we term as evidence-based practice. So for example, examples of quality improvement. You can realize that patients actually fall because they are moving on a slippery surface after the cleaners don't wipe the floors properly, and in the end you have patients falling. Okay, so you need to make sure that patients don't fall again. So what processes need to be improved? Can you change the time of cleaning Can you change the cleaner, the agents that are used for cleaning, the cleaning material? What should be done? Can we change the floor? Should we make the tiles, should we replace the tiles? What should we do? That is an example of quality improvement. Or at the ward, you can have issues where you have patients that have been surgically operated on, having what we term as surgical site infections. What can be done? So you institute different different interventions to make sure that the surgical site infections actually reduce. Now, research is different from quality improvement and is also different from evidence-based practice, but they are related. Don't get confused. So research is when you have a research problem that you investigate systematically. That means that you're going to follow structured processes such that you arrive at the right answer. And the right answer basically is the new knowledge that you have come up with. After you collecting this data, analyzing it, you have new knowledge. That is what you call research. So in definition of research, we usually include the one systematic investigation, okay, of a phenomena or a problem to generate new understanding or to generate new knowledge. That is what we usually define research. That's how we often define research. Okay? We conduct research when we don't have sufficient knowledge or evidence about a particular situation and how we are supposed to handle it. And therefore, when you're conducting research, we often tell you to tell us the research gap, because there is no need for you to do the same research that has been done by other people, and there is no gap that you have identified. So research is only conducted when there is no sufficient evidence or there is no existing evidence to guide how certain things are supposed to be done. That is what you call practice. So systematic is related to the word methodological, that they are things that we expect you to do. Okay? And if you don't do them, we say that your research is weak. So someone, instead of saying your research is weak, someone can just basically say that your research is not rigorous, or that person can basically say that your research is not methodologically rigorous. Okay? So it has to follow ethical principles and it has to be rigorous, meaning that it has to follow known principles of how research is actually conducted. So you don't just do research anyhow you want. And if you're going to do something that is quite new from what other people would expect you to do, you should give justification for why you are doing it in a new way and not what other people have been doing. So at the end, we can say that research generates new knowledge, okay? And often when we do research in one area, the findings can be applied in another area. That is what we call generalization, okay? So the findings are often generalizable, okay? And of course, the different research approaches have differing extents to which the findings can be generalized. We shall look at that when you're looking at the research methods. When we talk about quantitative research and qualitative research, where do we say that these results or these findings can be generalized? Okay? So for example, you can have a research that is looking at pain among ventilated patients. Basically, you're exploring how ventilated patients how they experience pain, the pain rating tools, how the pain is managed, and all those things. You can also have a study that is basically looking at examining communication at the end of life. If people have terminal illnesses, what are the communication patterns? This one looks more like a qualitative research problem. Now we come to the third term, which is evidence-based practice. Now this term, it has other ones related to it. So, for example, you can have evidence-based practice, evidence-based or evidence-based medicine. You can have evidence-based practice in nursing. You can have as many other terms as possible, or evidence-based practice in healthcare. Okay, so there are different variations of this term, but generally, the meaning of this term is that you have to use the best current evidence, clinical expertise, and patient preferences in caring for patients. So when you have a patient coming to you with a particular condition, how are you going to handle them? When, for example, they come with malaria, what medicine are you going to give? Are you going to give quinine? Are you going to give Coartem? And the decisions on, are you going to give orals, or are you going to give parenteral? Now, the decision that you will take will depend on the three things that I've just talked about. Current evidence. Because current evidence in this case could mean the evidence that is coming from research, what does it indicate? It could be possible that there is resistance to some of the antimalarial drugs. So you say, no, I will not give this drug because there is resistance to these drugs. Or you will not give an parenteral medication because you don't know how to give it. You don't have the expertise to give it, but you can give the oral. So that's the second element. The third element, the patient could say, for me, when you give me orals, I get this problem, so you give me this. And then you come up with the best decision based on the three elements: current evidence, clinical expertise, and patient preferences. So you choose the best to make sure that the patient receives the best quality of care possible. So, now this is how quality improvement relates to evidence-based practice. In your ward, you could be interested in making sure that the patients receive the best quality of care possible. Okay? You don't want patients to get harmed when they are in your department. So, to make sure that they don't get harmed in your department, it means that you need to be able to use the best evidence possible. So often, if the foundation of your department is on ensuring quality health care, it will be inherently that the health workers will always be identifying areas that need continuous improvement. Or the clinicians or the health workers will always raise questions on the things that they are doing. They will always ask themselves, but is this supposed to be done like this? So they have clinical questions. Now it is these clinical questions, this mindset, this culture of always asking that will often result and manifest through evidence-based what? Practice. Okay, so evidence-based practice can come from quality improvement measures and then it is manifested in what people do. And what people do, if they find out that there is no risk, there is no evidence often has to come from research. If there is no evidence, it means that they will conduct research to have the evidence such that they can have evidence-based practice. So you see, it starts from quality improvement, evidence-based practice, and then it comes to research. And then it is this research that informs evidence-based practice. So it is a kind of culture that has to be developed within the what? Within the health department or the health facility or hospital.